What if the real reason your blood sugar refuses to come down has absolutely nothing to do with how much you are eating, how carefully you are watching your diet, or how faithfully you are taking your medication? What if the missing piece is something so simple, so fundamental, and so completely overlooked that most doctors never even think to check for it? I know that sounds hard to believe, but stay with me for the next few minutes because what I am about to share with you today could genuinely be the explanation you have been searching for, possibly for years. I am Dr. Weston, and today we are going to talk about how to lower blood sugar naturally using 3 specific minerals that play a direct and essential role in how your body responds to insulin. In 15 years of clinical practice, I have worked with hundreds of older adults who are doing everything right on paper and still struggling. Eating carefully, taking their medication without fail, exercising when their body allowed it, and yet their fasting blood sugar stayed stubbornly high every single morning. Their numbers would spike after meals, their A1C would barely move, and almost every single one of them had been told the same thing: try harder, cut more carbs, you just need to be more disciplined. Today, I want to offer you a completely different explanation, one that is grounded in real biological science, and that I believe every single person managing their blood sugar deserves to hear. Before we go any further, I want you to drop a comment below right now and tell me honestly, have you ever felt like you were doing everything right and your blood sugar still would not cooperate? Just yes or no. And if you have ever been told your numbers are a little high but not quite diabetic yet, please add the word borderline to your comment. You are going to understand exactly why that matters before this video is over. I read every single comment personally, and today your answer genuinely matters. Now let me start with something that changed the way I think about blood sugar management completely. And once you understand this one concept, everything else we discuss today will make perfect sense. Most people, and honestly most standard medical conversations, focus entirely on insulin itself, how much insulin your body is producing, whether your medication is strong enough, whether your pancreas is keeping up, and all of that matters. But there is another piece of this puzzle that almost never gets discussed. And that piece is whether your cells are actually able to hear and respond to the insulin signal when it arrives. Think of it this way. Imagine insulin as a delivery driver carrying a very important package to your front door. The driver shows up on time, rings the bell, and waits. But if your doorbell is broken, or the batteries are dead, or the wiring inside the house is disconnected, the driver can ring that bell all day long and nobody inside will ever hear it. The package never gets delivered. The sugar stays out in the bloodstream with nowhere to go. And that is not a failure of the driver. That is a failure of the internal system that is supposed to receive the signal. Your cells have tiny receptors on their surface whose entire job is to recognize insulin when it arrives and respond by opening up and allowing glucose to enter the cell where it can be used for energy. But those receptors, that entire signaling system, requires specific minerals to function properly. Without adequate levels of those minerals, the signal never fully gets through. Insulin shows up, rings the bell, and nothing happens. Blood sugar stays elevated, your doctor increases your dose, insulin knocks louder, still nothing opens, not because your body is broken beyond repair, but because the internal machinery is missing the raw materials it needs to work. And here's something I want you to really sit with for a moment. This is not some fringe idea. Some research from major institutions studying large populations over many years has consistently found that people managing elevated blood sugar are significantly more likely to have low levels of the specific minerals involved in insulin signaling. Same diet, same calorie intake, same medication, but completely different cellular response based on whether those minerals are present at adequate levels or not. But wait, because what I am about to tell you now is the part that most people have never heard before, and it changes everything about how you look at this problem. I have a patient, a wonderful 69-year-old woman named Patricia, who came to see me after 4 years of frustration. Patricia was meticulous about her diet. She had cut out sugar, reduced her portions, walked every single morning without exception. She took her medication without ever missing a dose. And yet her fasting blood sugar every morning was still consistently high. Her A1C had barely changed in 2 years. She was exhausted, discouraged, and had started to believe that her body was simply not going to respond no matter what she did. When Patricia and I sat down and looked at the full picture together, including a thorough review of her nutritional status, what we found was genuinely eye-opening. Patricia had low levels of not one, but two of the three minerals we are going to discuss today. Nobody had ever checked them. Nobody had ever suggested they might be relevant. Once we addressed those deficiencies as part of her overall care plan, in collaboration with her other doctors, her results began to shift in a way they had not moved in years. Patricia told me it was the first time in a long time that she felt like her body was actually working with her instead of against her. So let us talk about these three minerals. And I want to explain not just what they are, but exactly why they matter and what happens inside your body when they are low. Because understanding the why always makes the what so much easier to act on. The first mineral is magnesium. And I want to be very clear right from the start that magnesium is not just one nutrient among many on a long list. It is specifically and directly involved in virtually every step of the process by which insulin communicates with your cells. When insulin arrives at a cell receptor, magnesium must be present for that receptor to activate the internal signaling pathways that allow glucose to move from your bloodstream into the cell. Without adequate magnesium, that activation simply does not happen efficiently. The signal is sent, but it is not received and acted upon the way it should be. Some research suggests that magnesium deficiency may be one of the most common and most consistently overlooked nutritional issues in older adults managing blood sugar. And here is what makes it particularly tricky. A standard blood test for magnesium is not always a reliable indicator of your true magnesium status. Your body is remarkably good at maintaining normal magnesium levels in your blood, even when your cellular stores are significantly depleted, because it will pull magnesium from your bones and muscles to keep blood levels stable. So your test result can look perfectly fine while your cells are genuinely running low. Pro tip number one, and this is something I wish more people knew to ask about. If you want a more accurate picture of your magnesium status, ask your doctor specifically about a red blood cell magnesium test rather than a standard serum magnesium test. It is not always easy to get, but it gives a significantly more accurate picture of what is actually happening at the cellular level where it matters most. Beyond blood sugar, magnesium affects sleep quality, muscle cramping, nerve function, restless legs, blood pressure regulation, and heart rhythm. And here is what many people find fascinating when they first learn this. Some research suggests the very first improvement people often notice when they begin addressing a magnesium deficiency is not their blood sugar, it is their sleep. They fall asleep more easily, they stay asleep through the night, their legs feel calmer, their muscles stop cramping. Those are not separate random benefits happening by coincidence. Those are all signs that your cells are finally getting the mineral they have been needing to function the way they are designed to. If this is already making things click for you, I want you to hit the like button right now. It genuinely helps me reach more people who need this information. And if you are not yet subscribed, please subscribe now and hit that notification bell so you never miss these health conversations. Now, the second mineral is chromium. And chromium works in a beautifully specific and important way that is different from magnesium. While magnesium helps the insulin receptor activate the signaling machinery inside the cell, chromium acts like a volume amplifier for that signal. Think of it like this. Imagine your insulin signal is a radio broadcast. The broadcast is being transmitted. It is reaching your cell. But if chromium is low, the volume is turned way down. The cell can barely make out what is being said. The message is there, but it is too faint to produce a clear, reliable response. When chromium levels are adequate, that same signal comes through clearly and strongly. The cell hears it, understands it, and responds appropriately. Glucose moves in, blood sugar comes down. The whole process works the way it is supposed to. When chromium is low, some research suggests the cell may become sluggish in its response. Blood sugar spikes after meals tend to be larger and last longer. Cravings for sweet and starchy foods often increase because the cells are not getting adequate glucose inside them, and the brain interprets that as a need for more food. That cycle of cravings leading to eating, leading to spikes, leading to more cravings is something many people with blood sugar challenges will recognize immediately. One thing I want to be very honest with you about is that chromium works gradually. Some people expect to see dramatic changes within the first week, and when that does not happen, they conclude it is not working. But what chromium is doing is slowly restoring the sensitivity of your insulin receptors at a cellular level. That is a biological repair process. It takes weeks and months of consistent support, not days. Patience and consistency are everything here. Pro tip number 2. One of the most common reasons people do not get results from nutritional supplements is that they take them inconsistently. A few days on, and then they forget for a week, and then they start again. Your cells need steady, reliable support over time, not occasional large doses. Think of it like watering a plant. One large watering followed by 2 weeks of drought will not keep it healthy. Small, consistent daily support is what allows genuine biological repair to happen. Now, the third mineral is zinc, and most people associate zinc almost entirely with immune health, with fighting off colds or helping wounds heal. But zinc plays a role in blood sugar management that is genuinely significant and that most people have never been told about. Zinc is directly involved in the production, storage, and release of insulin inside the cells of your pancreas. Your pancreatic cells need zinc to manufacture functional high-quality insulin in the first place. Some research suggests that zinc deficiency may contribute over time to a reduction in the quality and effectiveness of the insulin your body produces, and may increase oxidative stress inside the very cells that are responsible for making that insulin. For people who have been managing elevated blood sugar for several years, zinc levels are something that are worth paying attention to and worth discussing with your doctor. I want to tell you about something that genuinely surprised many of my patients when they first heard it. Certain medications that are very commonly prescribed to older adults can over time affect the body's ability to absorb or maintain adequate levels of these minerals. Certain blood pressure medications, particularly those that affect fluid balance, may increase how much magnesium is lost through the kidneys. Certain acid-reducing medications that many people take daily for years may affect how well minerals are absorbed from food. This is not a reason to stop taking those medications. I want to be absolutely clear about that. Please never change or stop any medication without talking to your doctor first. But it is a reason to be aware that if you are on certain long-term medications, your mineral status may need extra attention and monitoring. There's also something that very few people ever think about, which is the role that chronic stress plays in depleting these minerals, particularly magnesium. When your body is under ongoing stress, physical or emotional, it uses magnesium at a significantly higher rate to process the stress hormones that are released. If you are under consistent daily stress, whether from health concerns, family responsibilities, financial worries, or simply the cumulative weight of managing a chronic health condition, you may be burning through magnesium faster than you are replacing it. And that ongoing depletion has a direct and real impact on how well your cells can respond to insulin. Pro tip number 3, a 10-minute gentle walk after your main meals is one of the simplest and most consistently effective habits you can build for blood sugar management. Some research suggests that light movement after eating helps your muscles absorb glucose from the bloodstream more efficiently, which reduces the blood sugar spike that would otherwise follow that meal. It also improves circulation to the small blood vessels throughout your body. It costs nothing. It requires no special equipment. And it works. If you can do just one new thing starting today, let it be this: 10 minutes of gentle walking after eating your main meal. Now let me talk about where these minerals come from in food, because this is a genuinely important part of the picture. For magnesium, good food sources include dark leafy greens like spinach and kale, pumpkin seeds, almonds, black beans, and other legumes. For chromium, broccoli, green beans, and whole grains contain meaningful amounts. For zinc, practical everyday sources include beef, pumpkin seeds, lentils, and cashews. However, I want to be honest with you about something that most people do not know. Research has shown that the mineral content of many common vegetables and grains has declined significantly over the past several decades due to changes in modern farming practices. The same vegetables that provided generous amounts of these minerals to previous generations may contain measurably less today. This means that even a genuinely healthy diet may not be sufficient to correct an existing deficiency once it has developed. Food remains the foundation, but for many older adults, particularly those who have been managing elevated blood sugar for a number of years, targeted nutritional support under appropriate medical guidance may also be worth discussing with your healthcare provider. Tell me in the comments right now, has your doctor ever discussed your mineral levels in relation to your blood sugar management? I genuinely want to know because, in my experience, this conversation happens far less often than it should. Now, let me give you a clear and practical picture of what to watch for if you begin addressing these mineral levels. The improvements most people notice first, as I mentioned with magnesium, tend to be in sleep quality, muscle comfort, and overall sense of calm rather than in blood sugar numbers immediately. The blood sugar improvements come next, and they happen gradually. Fasting glucose may begin trending gently downward over several weeks. Post-meal spikes may become smaller and resolve more quickly over the first couple of months. Changes in longer-term blood sugar markers tend to follow over a period of several months of consistent support. These are realistic, gradual, sustainable improvements, not overnight miracles. Real biological repair takes real time. And that is actually a good thing. Extremely rapid changes in blood sugar can sometimes cause their own complications. Slow, steady improvement is both safer and more likely to be lasting. There is something else I want to address directly because it comes up very often. What about supplements already being taken, like a daily multivitamin? The form that minerals come in matters enormously for how well they are actually absorbed and utilized by your body. Many standard multivitamins use forms of minerals that are inexpensive to manufacture but that may not be absorbed well. Magnesium oxide, for example, is very commonly used in budget supplements, but some research suggests relatively poor absorption compared to forms like magnesium glycinate. Checking the specific form of minerals in any supplement you take is worth doing, and having a conversation with your doctor or pharmacist about which forms and amounts might be appropriate for your specific situation is always a smart step. Let me now bring everything together for you with a clear action plan that you can begin acting on today. First, and most importantly, schedule a conversation with your doctor specifically about your mineral status in relation to your blood sugar management. Ask whether testing your magnesium, chromium, and zinc levels might be appropriate given your situation. Come to that appointment prepared. Bring your blood sugar log if you keep one. Mention if you have been experiencing poor sleep, muscle cramps, strong cravings for sweet foods, or persistent fatigue alongside your blood sugar challenges. These symptoms can all be relevant to the conversation about mineral levels. Second, begin the 10-minute post-meal walk habit starting tonight. After your evening meal, step outside or walk around your home gently for 10 minutes. This is one of the most accessible and evidence-supported habits you can build for blood sugar management, and it costs absolutely nothing. Third, review your current diet for natural sources of these three minerals. Add a handful of pumpkin seeds to your day. Include more leafy greens in your meals. Choose whole grains when you eat grains. These are small, consistent additions that support your body's mineral needs over time. Fourth, pay attention to your stress levels and your sleep quality as meaningful pieces of your blood sugar picture. They are not separate issues. They are directly connected to how well your cells respond to insulin. If sleep or stress are significant challenges for you, those are worth addressing alongside everything else. And fifth, if you are on any long-term medications, ask your doctor at your next appointment whether any of them are known to affect your levels of magnesium, B12, or other key nutrients. This is a simple question that can open up an important and productive conversation about your overall nutritional health. So let me summarize what we covered today. Your cells require specific minerals, particularly magnesium, chromium, and zinc, to properly receive and respond to insulin signals. Without adequate levels of these minerals, insulin may be present in your bloodstream, but your cells may not be able to respond to it effectively, regardless of how carefully you eat or how faithfully you take your medication. Some research suggests these deficiencies are significantly more common in older adults managing blood sugar challenges than is generally recognized. Certain lifestyle factors, including chronic stress, long-term medication use, and changes in food mineral content, may all contribute to depleted levels over time. And addressing these nutritional foundations in partnership with your healthcare team may support meaningful, gradual improvement in how your body manages blood sugar naturally. You have been working hard to manage your health. You deserve to have every piece of the puzzle, not just the ones that are quickest to prescribe. Understanding this deeper layer of what your cells actually need is genuinely empowering. And every small, consistent step you take from today forward is moving you in the right direction. In my next video, I am going to talk about 5 specific foods that some research suggests may actively support healthy blood sugar levels and insulin sensitivity in adults over 60. You are not going to want to miss that one. So please make sure you are subscribed and have your notification bell turned on. If this video gave you something valuable today, please share it with someone you care about who is working hard to manage their blood sugar and may never have heard this particular piece of the story. That share could genuinely make a difference for them. Remember, this video is for informational and educational purposes only. Always consult with your personal doctor before making any changes to your health. If you found this video helpful, don't forget to subscribe to the channel and hit the notification bell so you never miss a health tip. See you in the next video.